Okay, so we'll just give it 2-3 minutes to let people join, and then we will begin. Thank you to everyone who is already joining. All right, Rene, I think I just promoted you to a panelist, so that should be covered.
Okay, I'm on.
Perfect. It's great to meet you, Rene.
Let me unmute you. All right, I'm on as a panelist.
Yes.
Okay, good.
And just before we begin, do you have a preference for how you're addressed? Do you prefer Rene, or would you like Dr. Settle Robinson?
Dr. Settle Robinson would be better.
Perfect. Thank you.
And I'm still driving home, so if you hear background noise, that's what it is.
Not a problem. Thank you so much for joining us.
Absolutely. I wanted to be as timely as possible.
Be careful, that's more important.
Absolutely. I'll be one of those people everybody's honking at tonight.
All right, we'll just give it one more minute and then we will do introductions.
Okay.
And then I would like to thank everyone who is joining. We have a really great panel for everyone tonight. I'm super excited to learn and listen from everyone. I guess we can just dive right in. If everyone wants to give, a brief introduction for themselves. My name is Jordan Pierre. I'm an organizer with the National Wildlife Federation, and we organized this in collaboration with the Wisconsin Health Professionals for Climate Action, and we're super excited to share this with everyone tonight. I guess I can, Rene, would you like to introduce yourself?
Absolutely. So I'm Dr. Rene Settle Robinson, and I'm a member of the Wisconsin Health Professionals for Climate Action, which is how I got enlightened about all of the things that climate change can do to our mental and physical health. As a result, I got involved in a year-long fellowship, postdoctoral fellowship through the Medical Society Consortium for Climate and Health called the Climate and Health Equity Fellowship, and completed that in 2022. I am currently practicing as a podiatric surgeon at Outreach Community Health Center, which is a federally qualified healthcare center in Milwaukee, Wisconsin.
Thank you so much. Huda, would you like to introduce yourself?
Yes, peace, salam, everyone. I greet you with the Islamic greeting. Assalamu alaikum, peace be with you. I'm Huda Alkaff. I'm an ecologist, an environmental educator, and the founder and director of Wisconsin Green Muslims, which is a grassroots environmental justice group that connects faith, environmental justice, sustainability, and healing through education and service. We have started in 2005, so for 18 years now. We educate the community around climate, water, equity, and just solar and transportation justice. So yeah, we cover it all. Thank you.
Thank you, Huda. Very excited to have you tonight. Dr. Somesh, would you like to introduce yourself?
I'm Dr. Somesh Roy, and I'm an assistant professor in mechanical engineering. And my research is on one of the particulate matters that we're going to talk about today, soot, and is also called black carbon. Is also one of the most prominent and factor in climate change and has a lot of negative health impact. I'm sure we're going to talk some things about those things in today's panel. My research looks at very fundamental aspects of what is soot, and we're still struggling with that basic question, what this particulate matter is. But as I claim myself, I'm trying to track the history of the planet, how it started and how it's going now by tracking the history of soot itself. So I'm excited to be here. Thank you.
Thank you. And then Lillian, you can introduce yourself as well.
Yes, thank you for having me. My name is Lillian Jensen, and I am a nursing professional development specialist. And it's a really long title to say. I help design and design education for nurses. I'm here on behalf of the Wisconsin Health Professionals for Climate Action, also a member of the Alliance of Nurses for Healthy Environment, and looking forward to sharing some information about health and from a nursing lens, what we're seeing with patients these days in relation to climate change.
Thank you so much. And then not a panelist, but going to share briefly at the end of the panel, Langston Burden with Milwaukee Fresh Air Collective. Langston, would you want to introduce yourself as well?
Thank you for inviting me to share a little bit of information. I'm Langston Burdine, founder of MKE Fresh Air Collective in Milwaukee. It's a neighborhood level air quality monitoring project that was launched about 2 years ago.
Perfect. Thank you so much. So then we can dive right into the questions. The first one is for Dr. Somesh Roy. Particulate matter, soot, or PM 2.5, this pollutant goes by many names. As a mechanical engineer and researcher, can you tell us what it is and where it comes from?
Sure. So as the name suggests, particulate matters means it's particles which are basically floating in the air. And typically the size of these particles are very small and usually so small that you wouldn't be able to see through your eyes. They are hundreds of times smaller than the width of a human hair. Now, when we talk about this soot, black carbon, all of these terms, they are specific types of particulate matters. All of these combined fall under the umbrella of particulate matters. And when I'm talking about particles, they're not just solid particles, they can also be droplets or liquids that is also deemed under the same category. So all of these things combined together are the particulate matters, and within them, if we look at the really tiny ones, the ones that has a diameter, the size almost thousands of times smaller than a human hair, those fall under the category called PM 2.5, which is 2.5 signifies the diameter of those particles, and that's 2.5 micrometer, which means 1 million micrometer will make 1 meter. So that's the smallest size, that's the size of particles that you're looking at. Those are PM 2.5. And then the larger of these are called PM 10, which is larger than PM 2.5, but smaller than 10 micrometer in size. So that's the two main categories of PM 2.5 and PM 10. Now these things originate from varieties of sources. Many of the smaller ones, fine particles like PM 2.5 originate from combustion. We call them soot. There are other things that originate from combustion. Sometimes they're termed as black carbon, sometimes they're termed as brown carbon, depending on their properties, depending on where they're coming from. There are other things such as dust. There's things like pollen. Those will also be part of the borderline PM10. Pollen size is roughly slightly higher than PM10. Agricultural dust, road dust, as you are driving through roads, the tire abrasions of tire that creates a dust particle. All of these things are contributing to this whole umbrella of things called particulate matters. So that's kind of a very broad umbrella to capture almost everything that's floating in the air.
Thank you so much for enlightening us and giving us a bit more perspective on soot. And then the next question for Lillian. From your perspective as a nurse, what are some of the health effects of particulate matter on human health and community health?
Yeah, great question. So I think that when people talk or think about air quality and they're thinking about this particulate matter, they're really thinking that it must have a lot to do with respiratory or lung diseases. And it's true. You're going to have impacts for people that have asthma, that have COPD or emphysema. And we certainly know that lung cancer risk has a positive association with particulate matter and higher areas of particulate matter. But I think what people might be surprised to find is actually there's a huge cardiac or heart risk with particulate matter as well. So those tiny particles that he was talking about, Dr. Somesh was talking about, can actually enter your bloodstream through your lungs, and they damage the inside of your vessel walls, and it makes them harder, a little bit more tougher, and that can increase your blood pressure. That can increase clotting, and so you might have heart attacks or strokes. And so you're having a whole bunch of cardiac effects from particulate matter as well as respiratory damage, right? So that means for older Americans, this can also result in lower HDL, which is that good cholesterol. There's heart disease there. For our premenopausal women, there's established links between short-term daily exposure and hemorrhagic stroke. So that's premenopausal. And then unfortunately for our pregnant women, especially traffic-related pollution in terms of air quality, is increasing risk for hypertension, which leads to preterm birth, low birth weight, maternal and fetal illness, and ultimately death. So we know from the WHO that about 12% of all deaths worldwide are attributable to outdoor and indoor household air pollution. So this is a pretty significant contributor to individual and community health.
Definitely. Thank you so much, Lillian. Sort of building off of that, for Dr. Settle Robinson, you work at Outreach Community Health Center in Milwaukee. Are there any specific health impacts that you see in your patients or neighborhoods?
You know, when I first started my postdoctoral fellowship on climate and health equity, I wondered, why is it that since everybody has diabetes, high blood pressure, heart disease, asthma, arthritis, all these different conditions, that why is it that Black people tend to have it 2 to 10 times worse? And I found out that a lot of it has to do with a dirty little secret hidden within the world of climate change called environmental injustice. So, like where you see the programs on the commercials on television talking about Camp Lejeune, people who have been exposed to toxic chemicals in this environment. I say that there's a Camp Lejeune in every city in the United States, because those communities that have been redlined are the communities where Black people are directed to live. They've been redlined because those communities have the highest levels of pollution and are designated as uninhabitable for human life. And it also serves the purpose of letting the banks and the insurance companies know that these are people that are not going to live long because of their exposure to toxic circumstances in these redline communities. And that allows the banks and the insurance companies to say, well, we're going to charge you more for our products, or we're going to deny you our products altogether, because they know that the pollution level is high enough in those communities that life is going to be short for people. So we talk about premature birth. Well, there's also premature death, as well as higher levels of every health condition you can imagine when you live in those communities. When you compare the level of air pollution in our red line communities here in Milwaukee, specifically the 53206 Lindsay Heights area, compared to our white suburban communities, our white suburban communities have air pollution below 10%. In our red-lined communities, it's above 40%. And yes, they're correct that the 2.5 micrometer particulate matter not only gets into your lungs with all of the particulate matter, increasing asthma attacks. The 2.5 is small enough to not only get into your bloodstream, but it will cross the blood-brain barrier. And so it has a very negative impact on the overall health of individuals who are exposed to that level of pollution.
Thank you so much for sharing, Rene, and thank you for highlighting environmental justice and equity, and building further on that. Huda, you have founded numerous environmental justice groups and served on the Southeast Wisconsin Regional Planning Commission and Environmental Justice Task Force, the Milwaukee Environmental Justice Roundtable Leadership and Planning Team, and the Wisconsin Environmental Equity Tool Ad Hoc Advisory Committee. A recent study from the University of Illinois found that people of color in Wisconsin are more likely to be exposed to harmful air pollution than white people, creating the third highest racial disparity in the nation, behind only New York and Pennsylvania. Why are people of color more vulnerable to the harmful effects of particulate matter, and what can we do to ensure that everyone has clean air to breathe?
Yeah, follow up on the zip code that was mentioned, 53206. Well, Wisconsin Green Muslims is based in Milwaukee in zip code 53205. So that zip codes, and those are zip codes, neighboring zip codes, that's where a child living in this zip code 53205 is 20 times more likely to go to the emergency room for asthma than a child in the more affluent neighborhood, only a 15 minutes car ride away. So this study that was mentioned, the Tissam and colleagues, yeah, it was not only University of Illinois, but it's a collaboration between many universities. So University of Washington, University of Texas, University of California. So it was a collective, and University of Minnesota. So definitely it's a collective effort, and we need to recognize this collaboration there. So in this study that was mentioned, yeah, the PM 2.5 polluters disproportionately and systematically affect people of color in the United States, and follow-up analysis by Clean Wisconsin found that people of color are in Wisconsin are definitely exposed, more exposed to harmful air pollution than white people. And people of color in Wisconsin are exposed to 44% more particulate matter pollution from industrial sources than the state average, with Black residents in particular exposed to 67% more pollution. And the Milwaukee area has by far the largest disparity, as it is the top most segregated city in the nation. But this disparity persists in other major cities examined in the study, including Green Bay, Appleton, Wausau, and Sheboygan. And I would also mention that in an analysis in 2021 of the EPA data, it's documented that regardless of region or income, people of color are disproportionately and chronically exposed to higher than average soot pollution from nearly every major source, such as power plants, cars and trucks, and manufacturing, which tend to be concentrated in our communities, a result of a legacy of disinvestment and discriminatory practices, including redlining, as was mentioned. So this is all collective and compounded impacts. And so it definitely needs to be addressed in that way, looking at all this. And solving it needs to have a multi-solving approach, such that we look at how we can address all these cumulative impacts and not just separate them one at a time. So definitely we need to look at the collective wisdom of our communities. So we are part of a national environmental justice leadership forum. And through that forum, we have established a Clean Air for the Long Haul cohorts, which is a national group of environmental justice organizations working together to put forward campaigns and embed environmental justice in EPA rulemakings, such as the one that we're talking about now, in the power and transportation sectors. And our organizations consider the National Ambient Air Quality Standards for Particulate Matter proposal as a critical environmental justice rule that needs to be as strong as possible in order to deliver clean air and save lives for many low-income indigenous and people of color across the nation. And we definitely we're gonna talk about what the recommendations that we are supporting, definitely not what the EPA is proposing. So we can talk about that in a little bit. Yes.
Thank you, Huda. And since that was a pretty broad question on my part, I would love to open it up for the other panelists to weigh in as well. If anyone has anything to add, what are some additional overlapping vulnerabilities or solutions for clean air that you see?
I want to add, the area code, the 53205, I mean, that's directly from our Wisconsin hospital data. But there is a reporter named Talis Shelbourne and published a really stellar piece. If you haven't seen it, it's called Fight for Airs in Milwaukee Journal Sentinel, a special news article in August 2022. And it was really where we first kind of highlighted that information from Wisconsin hospital data about the asthma and ER visit rates. But she did a fantastic job of hearing from people in the community and hearing from providers that were working with people in the community and trying to figure out the whys behind why that was happening. And so I absolutely encourage, if some of this conversation might be a little bit too high level for some of our participants, I know that sometimes scientists or healthcare providers, we can speak at a kind of a more advanced level. If you want to see kind of the nitty gritty of it, that was a fantastic conversation, I feel like, in that article, and highly recommend it.
Thank you, Lillian. And then Dr. Somesh Roy, you're working on a unique engineering project to reduce soot pollution. Can you tell us sort of the more digestible additions that we can understand of what your team is doing to improve air quality?
Yeah. So part of the reason that this is a big problem, soot or particulate matter, is that we haven't been able to actually identify all the details, or we haven't been able to actually understand the ways and the mechanism this soot gets formed and how does it disperse in the atmosphere. We have a rough idea, but it may be surprising to hear that every one of us is burning candles in their house at some point, but that candle is actually producing a lot of soot too. But we still don't know, and we have been burning candles since when? But we still don't know how exactly that wax, the paraffin, whatever we were burning, gets converted into those black particulates called soot. So what we are doing in our research is we're actually one of the first few research groups who have been able to kind of find out what exactly the atomic structure of soot looks like. Once we know things like that, we can help figure out what are the properties going to look. If we know the atomic structure, if we know atom by atom, then we can get a better sense of what's the toxicity and how can we control the toxicity of soot. How can we control its impact on climate change, because soot is the second most important factor in climate change. How can we control, or how can we mitigate all of these effects? The point is that we wouldn't be able to completely eliminate soot. That's almost impossible, because we are talking about combustion or burning, which is going to, even if we carve all our human generated soot, there's still going to be wildfire, and that is going to produce particulate matters, that is going to produce soot. So if we know what exactly it is, then we can control it. If we don't know who our enemy is, we can tackle them. So that's basically where I am coming from on this. And we're also trying to educate everybody about the science and the uncertainty and the problems that we face in terms of soot, so that gives a better sense of what we are dealing with and what we can make action or take action individually. We have actually an exhibition running in Marquette campus called in Haggerty Museum of Art, focusing entirely on soot and black carbon. And I would invite anyone in the panel and participants, if you get a chance, visit it, because this is a collaboration between an internationally contemporary artist and our research. We are trying to bring together various ways that you can see these invisible particles. We're also having a series of coming back to what Huda, you mentioned about this environmental justice. That is a very burning question, and we are trying to organize a series of walks where we are going to collect air quality in several neighborhoods while talking about the socio-demographic and socio-economic history of those neighborhoods, and trying to come up with some personally actionable item. Yes, of course, we need accountability. We need the responsibility goes on to the EPA and other governmental agencies as well. But as a human being, we can also take small actions to combat this. We have to be in this together. All of us have to be together in this. So that's the angle of research that we're taking, trying to figure out the basic fundamental things so that we can handle them, tackle them, and mitigate them.
Thank you. Very interesting. Thank you so much for sharing about that. And then I believe Huda touched on this as well, but the Clean Air Act has been extremely important when it comes to protecting our public health. It requires the EPA to determine national ambient air quality standards for common outdoor air pollutants known to be harmful to public health and the environment, which includes soot. The EPA is required to review the standard roughly every 5 years, and this review process is happening right now. So Huda, could you tell us why it's important for people to submit these comments to the EPA on particulate matter? And is the process hard or time consuming?
So I would like to first mention what are the basic principles of environmental justice. So they are these principles guide our work. So to ensure public involvement of economically disadvantaged and minority groups in decision-making, to prevent disproportionately high and adverse impacts of decisions on economically disadvantaged and minority groups, and to assure economically disadvantaged and minority groups receive proportionate share of benefits. So in order to accomplish that, definitely we need to participate. We need to have our voices heard. And the environmental justice movement has defined the environment as the places where we live, work, play, pray, and go to school. We speak for ourselves, and nothing about us without us became and is the motto of the movement in challenging environmental and all forms of structural racism. So with that, definitely we need to be involved. And this is an opportunity for us to voice our concern, because the standards that the EPA proposed are not what would benefit our communities. We need to do better and have much stronger standards. So on February 22nd, I testified at the EPA public listening session on the National Ambient Air Quality Standards for particulate matter, and definitely voiced our concern about the proposed standards as they are right now. So through campaigns from our Clean Air for the Long Haul, we are advocating for the EPA to finalize strong health protective PM standards that is aligned with law and the latest science. So an annual standard no higher than 8 micrograms per cubic meter, and the 24-hour daily standards no higher than 25 micrograms per cubic meter to safeguard communities overburdened by the cumulative impacts of soot pollution before the end of 2023. So definitely, I'm going to submit my comment, the one that I testified, and we are also going to work collaboratively to submit detailed comments before the deadline, which is March 28th. Is that correct? March 28th?
Yeah, 1 month from today.
Exactly. Yeah. Don't wait till March 28th, though.
Exactly. Do not wait until March 28th. And then I just wanted to also highlight, thank you, Abby, for putting the link to submit comments in the chat. It's very simple. And then I'm sorry, Huda, did I cut you off or interrupt you?
No, I would just say that we need to be motivated, we need to be inspired and overcome the difficulties of submitting any comments. I mean, it just takes some training a little bit, some people to really support each other, which that's what we join coalitions to support each other in order to submit this comments together. And it once you do it, it becomes easier, and there is support for that if you need, as we mentioned, the resources available. So don't make it an obstacle. Hopefully we can all make it make our voices heard. Yeah.
Exactly, thank you. And yes, the link to submit comments is the Wisconsin Health Professionals for Climate Action. It's fantastic. It has specific asks and it links other talking points and information so that you, before you submit a comment, you have the proper information to form your comment and take action. And then moving on to the next question for Lillian. With inflation, some families are concerned about the costs that are associated with this air quality safeguard. What would you like those families to know?
Sure. So I think this fear might come from, well, if we put these rules on corporations and corporations are going to say, fine, we're going to have to do all this work, right? And it's going to cost money, and now your energy costs are going up, which is already happening, I would say now. We've seen, especially in Wisconsin, we have seen energy costs go up without this. And that's a totally legitimate fear. We have inflation going on. There's money doesn't go as far as it used to. I think there's two things that we can look at in terms of cost if we have to put a price on stuff. So we talked about the impact it has to communities, impact it has to individuals, the disproportionate impact it's having on communities of color. If we take all that away and say, none of that we're going to talk about financially, we're just going to say, forget about that part. There's two other costs that we're looking at here. We have the hidden cost of the healthcare that is happening as a result of air pollution. So we're estimating about 50,000 deaths in the US a year that's attributable to air quality pollution. And that's about $6 billion a year. So if we can mitigate some of that, preventative care is always better than reactive care, right? So if we can mitigate some of that, we can get some of that cost back. And that is paid for taxes, right? Medicare, Medicaid, that is paid for taxes. So even if you as an individual aren't necessarily feeling the effects, or your family or community, for some reason, you don't see the effects, you are going to see that cost there. And then the second part is actually, it's kind of the carrot and stick model with some corporations, right? Is that the stick part is, here are some fines, here are the rules that are coming from the CPA, you need to do this. That might get them to invest in clean energy. And what happens when we invest in clean energy, I've got a really wonderful chance to connect with union representation, some union workers, especially the Painters and Glazers Union. I learned all about glazing. It's not about donuts. I got to connect with them as we were celebrating the Inflation Reduction Act and all of the great, hopeful clean energy jobs that are coming out of that. They'll be union-based, that'll be local, that will have healthcare, that will be paid at a rate that's really appropriate. And so the creation of those jobs, I think, is also in the cost, or the bringing back of the cost of this. So yes, there may be some energy. We can hope that there isn't, but we haven't seen that with corporations necessarily eating the cost and taking that on. But if there is an investment in clean energy, that cost should reduce, because the amount it takes for those energy jobs is considerably less than traditional energy mechanics like coal, for example. So one, we're going to see a relief in healthcare costs overall for individuals, for families, and of course for taxes. And then two, this hopefully promotes the investment into clean energy jobs and clean energy, and which will then have a job component to it, and then further on down the line, reduce the cost of energy overall.
Thank you. Yes, thank you for highlighting how it's all connected in one way or another. So, then the next question is, again, open to all of our panelists if anyone would like to, share an answer. Is there an urgency around controlling fine particle pollution, and do people need to act quickly on this issue?
I would say absolutely there's an urgency to controlling fine particulate matter because of its connection between ill health, and we've talked a lot about physical ill health, but we need to also talk about the mental ill health that's also associated with climate change. Fossil fuel combustion is what's fueling the global warming. And so anything that we can do to reduce fossil fuel use, in particular electronic school buses, electronic public transportation, and individual purchase of electronic cars. All of those things can reduce fossil fuel combustion and reduce the global warming, and ultimately translates into improved health. The mental health part of it is related in part to the need to plant trees. Trees are probably the most natural air filtration that we have available to us. And unfortunately, in the communities that we identified, there are not enough trees. Somebody must have gotten the bright idea that, if we cut down the trees in these communities, then the criminals that are running away from the police won't have a place to hide. And unfortunately, it leaves a landscape that is too heavy with asphalt and not heavy enough with the natural air filtration that trees provide. So we need to turn those communities around by planting more trees.
Thank you, Dr. Sel Robinson, for sharing. And then, would any of the other panelists want to answer? I can repeat the question as well if anyone would like.
Yeah, I was going to add to what Dr. Sel Robinson mentioned, that the urgency, yes, of course, there is an urgency. A funny thing about soot, which is one of the main constituent in the particulate matter and all, one of the main health risks as well, is that its lifetime is just a couple of weeks in the air. So, and within that couple of weeks, it only flies as the wind blows. So it doesn't going to fly more than a couple of 1,000 miles, which means that if we can reduce our combustion, we should be able to see almost an immediate effect in terms of amount of soot in the neighborhood. And that's part of the personal actions that we can kind of try to make even in a small way. So it's not a big thing. It's not a big ask that we need to get rid of also. It's actually just a couple of weeks, give it a couple of weeks time, it'll come down on its own. As compared to greenhouse gases or carbon dioxide, the things that are fueling climate change, that lasts thousands of years. So there is, I want to say there is something good about soot too, because it's easy to mitigate if you know how to. The point is, we need to figure out how to.
Thank you for sharing.
Yeah, I want to add to that. The thing that's really hopeful about air quality is that local action has local impact. As opposed to some of these other, heat waves, extreme weather events, it can feel a little like, oh, I'm just one person. That's a global issue. But yes, absolutely, the things that we do in our communities here, the things that we say, no, we want clean air. We want to have a clean air community. And we can do it, and we can do it at this smaller scale and really show that. I think the urgency is interesting because you look at the tragedy of what happened recently in East Palestine, Ohio, right? The train derailment, the environmental just disaster that has happened there. And it's on the news, it's on national news, and everybody talks about it and they know about it. And it's and not to make it any small in any sorts of way, but that kind of thing is happening here. But it's like looking at a heart attack patient. Oh my gosh, that is a crisis. That is a critical moment. But you yourself have high blood pressure and some risk factors that you're just completely ignoring because you don't feel it in the moment. And you're not going to feel it until you have that heart attack. So we're in that moment where we are having these risk factors, we're having these moments, but we don't see it at such a disaster stage as what's on the national news right now. But I think we need to take it that way, because now is the time that we can address these kind of these things that we can do now to reduce that impact to ourselves or as individuals in our communities.
I think the businesses that provide the greatest amount of pollution in these communities and are most guilty of contributing to air pollution bear the biggest responsibility for mitigation. They need to make sure that their businesses capture that particulate matter before it destroys the health of the people in the community that surround those businesses. The people in those communities have the lowest income and oftentimes the lowest education, and therefore it makes them much more vulnerable to having additional industries come in that want to pollute. They'll say nice things like, we're going to bring jobs, and who wouldn't want some amount of economic prosperity in their community, but not knowing that these are businesses that are going to bring even more illness and destruction of life as far as pollution that they bring. Most of the times, these are the communities that are most welcoming to businesses like that, but they need to take responsibility, because these are people in these communities that contribute the least to the problem, but are suffering the most and have the least resources to fix it. The people who did it need to take responsibility for mitigation.
Thank you, Dr. Settle Robinson and Lillian. It most definitely is urgent and second everything everyone has been saying. Want to make sure that everyone, got the chance to say their piece for that last question before moving on. Okay, I think we're good. So I wanted to, again, thank the panelists so much. You are all incredible. This next, not really a question, it is for Langston Verdane. He is from the Milwaukee Fresh Air Collective, and we are very lucky to have him joining with us tonight. Langston, could you share a little bit about your work and how people can find information about air quality and monitoring?
Yeah, I mean, frankly, I'm lucky to be a part of this fantastic group. You all can count on getting an email from me to learn more about the work you're doing, but also make sure that we connect on this work. So I started this work a handful of years ago because I have a daughter with asthma. As I was nerding out and trying to learn more about asthma and how to keep her safe, and sorry if you hear my youngest daughter crying in the background, I started to learn that the air right inside my home, but also right outside of my home is tremendously important. And as I tried to explore the air outside my home, there wasn't a great resource for that. The DNR's air sensor, as great as it is, was about 3 miles away. So I didn't really feel that it gave me a full picture. And right around the same time I was having that question, that kind of internal dialogue, the brush fires were happening in Australia. And I found a really cool website that showed me real-time neighborhood level air quality that was horrendous via a website that was created by IQ Air. And so I reached out to IQ Air. Long story short, it's a long story, but I'll give you the short version. I've partnered with them for the last 3 years. They've provided MKE Fresh Air Collective with about 12 outdoor air quality monitors that we have on a network in the Milwaukee area that have been collecting data throughout the pandemic. And more importantly, I think it's notifying community members of poor air quality events and gives them information about what to do, right? When the air quality becomes really bad. And sometimes it's as simple as, well, go inside, right? Or put a mask on or close your windows. And, you know, air quality is great, go outside, enjoy the day, right? Some of those small things are important, especially when we think about the disparities related to asthma in the Milwaukee area. I've been really intentional about placing these air monitors in the communities that if you had a chance to look at the article highlights some of the disparities, especially around the northwest side of Milwaukee. I have probably about, I think, 2 air monitors left. So if you or your organizations, I'm looking specifically to place a air monitor in the Sherman Park neighborhood. So if you or you have organizations that work there that would like to have a free air monitor set up, all you need is a outdoor outlet and Wi-Fi. It doesn't even need to be good Wi-Fi, at least average Wi-Fi. I'd love to work with you all to get air monitor set up in the Sherman Park neighborhood as soon as possible. We also just launched a new website, mkefreshair.com. I'd encourage you all to check it out because I will be checking out all of your websites as well as reaching out. So thanks for giving me the opportunity to share the work that I'm doing. Thanks for Abby and Wipka for inviting me. And I'll stop there.
Thank you so much, Langston. That's incredible. First off, thank you so much for being the one to, you know, start something like this and be able to provide air quality monitoring throughout the city. It's very important. It gives people, you know, some agency over their own neighborhoods and the air that they're breathing. So thank you. And then we'd love to open it up if any of the attendees have any questions. We would prefer if they were used through the Q&A function. I see that we actually already do have an open question from Erica. Question, can the panelists, you can also read the Q&A questions, correct? I think so, yes. We have another question from Laura. Would the panelists prefer if I, you know, read these questions out loud and they answer, or would they prefer to read them themselves?
I can take that question, Jordan.
Awesome.
Thank you, Erica, for your comment. That is definitely tree maintenance. That's definitely one of the things that needs to be considered. It's not just planting tree. But coming back to Laura's question about soot pollution being worse at different times of the year, yes, it is. And that's related to the weather pattern and the climate. Typically, and I'm saying typically because the local climate changes from within like few miles to few miles, things can change. So typically, winters are the worst because there is this thing called temperature inversion, which means that the cold air gets trapped inside near the ground surface, which is why all the things that we are going to emit is going to get trapped near our breathable air. Whereas in summer and spring, that doesn't happen. So winter usually is worse in that category. And not only that, typically, again, it depends on the local, very local things. Typically, evenings and early mornings are worse during the day because for the same reason, the ground gets cooler quickly. So the air on top of the ground, that becomes cold and cooler than the air above us. And the cold air gets trapped by that hot air above us. And basically that traps all the particulates and everything in there. That's one of the reasons we would see smog events happening early morning, or you'd see haze happening early morning areas and so on. So we have a sensor in the Marquette campus, and we have seen 4 a.m. to 5 a.m. is the time that we record probably the highest level of particulates in that region. So there is a pattern, and it varies very much with the local weather patterns.
That's interesting. Thank you, Dr. Somesh, for sharing about that.
Yeah.
I see Erica. We will start with Erica's question. It says that they would like to second the positive impact of urban canopy for air quality improvements and and capturing carbon, but also for resiliency, aesthetics, and energy efficiency and cooling effects. They go on to say there are so many grants to fund tree planting, but not tree maintenance. While working on a heat health assessment in Milwaukee, we found that most homeowners that they spoke to do not want to plant trees because of the maintenance costs and potential damage to nearby structures. They say I've seen public utilities that cover maintenance on private property and would love to advocate for focus on energy to fund tree maintenance on private property. So I guess that's less of a question and more of a continuation, but I would like to thank Erica for that. And if any of the panelists have any thoughts on that and would like to share.
I would just like to comment on the fact that we do have a president right now who has gotten the Inflation Reduction Act passed and was smart enough to add on a piggyback act called the Justice 40, saying that 40% of the funding directed into the Inflation Reduction Act should be specifically set aside for those communities that are most affected with environmental injustice, as we've discussed tonight, to make sure that 40% of those dollars go directly into mitigation. And if maintenance of the trees, once they're planted, is part of the problem, then certainly somebody should be able to make a case for directing some of those Justice 40 funds into the community specifically to address that issue. Because you're right, all of the other things from air filtration to aesthetics to lowering the heat index and potentially lowering asthma incidence, all of those things are good enough reasons to be inclusive of the care and upkeep of those trees as they grow.
Thank you, Dr. Sel Robinson. I second that. Very important. We had another attendee ask, does soot pollution harm pregnant women? They are wondering if it can cause premature birth or other problems.
Oh, I have to address that because in the Milwaukee Times newspaper on Thanksgiving Day, 2022, I published an article talking about the disparity between Black and white women with regard to preterm birth and related 3 major issues related to climate change that contribute to preterm birth. Air pollution contributes not just to preterm birth, but to preterm death for a lot of the reasons that we've already discussed. So I would love to refer you to that article.
Thank you again for sharing. Did anyone else want to share anything on that question? So then we had another attendee ask, how does climate change affect soot pollution and vice versa?
So I can try to comment on that. It is a big cyclic relationship in some sense. So soot, I mentioned earlier also, and soot is the second most important factor in climate change, second only to carbon dioxide. And the problem with soot is we don't know a lot. We don't know the exact properties and exact exact ways that the soot impacts the climate. So there is a lot of uncertainty in what's going to be the impact of soot pollution. The climate models are predicting that the global temperature rise could be between 1.5 to 3 degrees Celsius, depending on how you are modeling the properties of soot. So there is a lot of uncertainty in there. But what happens with soot is that it's usually a black thing, so it absorbs a lot of sunlight, and it makes the air where it is slightly hotter. And when you have hot air, that basically changes the weather pattern, the pattern of the airflow, that affects the formation of the cloud. So we are going to see different rainfall patterns in different regions. Actually, we are already seeing near the equatorial region or tropical region over Indian Ocean, the rainfall pattern and the monsoon pattern are changing, and that's primarily because of impact of soot. When this soot, I said it stays in the air for a couple of weeks. When it gets deposited on the surface. And when this soot gets deposited on the glacier, particularly if you're looking at the industrial nations in the northern hemisphere, their soot can fly to the Arctic glaciers, and that is going to promote melting of the glaciers much faster than otherwise it would have. So that's how the cycle, that's how soot basically impacts the climate change, by affecting the energy in the planet, the energy of air, the energy, how it melts the glacier, and all of these things. Now, as the weather patterns changing, that affects how soot is going to get dispersed. If your airflow is going to change because soot is is hitting up locally some air in some region and cooling down somewhere else, so that changes the airflow pattern. That's going to change how the soot is going to spread. So there is another feedback coming in from there. Now, as the air gets warmer, we are seeing more and more wildfire. Like I think Langston, you mentioned about the bushfire. The more wildfire means more soot, so that fuels in even more production of soot. So that's how things are entangled with one another. So that's kind of how things go. I hope that answers some questions and probably brings up many more.
No, thank you so much for talking about that. We had another attendee ask if their individual comment to the EPA could make a difference. Anyone would like to?
Yeah, I'll take that. So at the public hearing that I testified at, and other also public hearings that we testify and participate in, it's very important, very, very important to share your story. It's very powerful. You have a lot of power there. In just, they give you 3 minutes, 4 minutes, but you can put in it, just share your story. How the air is impacting you. That resonates. That's unique to you. That's your own story. That's very unique, very special, very powerful. So don't hold back. Say it. Tell people. It's very inspiring. It inspires many people to also tell their stories, and they listen to those stories, and they really value those stories. They're very important. Statistics do not, like, they can get the statistics, but they cannot get the personal stories. So personal stories matter a lot. And if we don't share them, no one will know about them. So let's share our personal stories, how the air, bad air, polluted air impacts us and our kids or families, elders. That's very important to mention and to share. So definitely your individual comments and testimony is a lot of value in it, and a lot of impacts.
Thank you, Huda. You are so correct. Our personal stories have so much power behind them.
I'd like to add, in 2020, the same policy was also, we did this again last in 2020, and that launched me. I did the testimony. I was scared. I was so scared. I was like, I don't know what I'm doing. I did it, shared my story, and it wasn't that painful, and I was one of several. But it brought me to being a part of an organization. So the Wisconsin Health Professionals for Climate Action, I know many of us on this call are parts of organizations. And I want to encourage anyone that's interested, not only to do this comment, but if you want to do something else, is become a part of an organization that connects to you and where you're coming from, because that opens the door to all sorts of things that you could do. You can be here, be a part of this panel, you can do speaking events, you can write articles. Don't try to do it alone, because you can absolutely be maximized by some of the great organizational work that is happening around you. So connect, please, with one of many. We have several on the call here today that can help you be a part of whatever, big or small or huge, whatever you can give of your time, of your expertise, of yourself towards this good work. We're ready and waiting for it.
Yeah, I would like to mention as well that when I testified, the person who was before me was an industry person talking about like encouraging EPA not to not to do, even like they were against what the EPA is doing in another sense. Like they're saying it's very restrictive, very like we impact industry in a negative way. So I was so happy that I was following that to counter that that testimony, and that like really resonated with me, how important that I was there to counter that testimony, to really share my own story and say that no, you need to do better, not worse, you need to do better. So that's where you really see when we talk, when we speak the truth, then that balances or maybe overcome the other voices that will discourage any strongest standards that our communities need.
Collectively, we make a difference. Every voice is valuable, including yours.
Thank you, everybody. Thank you for sharing. And someone had asked just to reiterate how they can submit a comment. I can, quickly answer that. So I will put a link into the chat, and it will take you to a page where you can submit a comment through Wisconsin Health Professionals for Climate Action, and that comment will be submitted to the EPA. It's a great link. It makes things very simple. It gives a great set of key takeaways on what these proposed standards would be. It even provides a bit of an outline for a comment, though, as Huda and Dr. Settle Robinson had mentioned, your story is powerful, so we always encourage people to make it personal and your story to share with the EPA. But yes, the link that was just put in the chat, it will take you to a great page that has a lot of great information and makes submitting a comment very simple. And then we do have a few more questions that I would love to make it through. Someone had asked, they said that Langston mentioned that his daughter has asthma. Is soot pollution worse for children?
I mean, I think that there are some aspects with children that are going to be different than adults. So there's one thing of playing outside, simply, sports being outside, recess being outside, playing outside, much more than adults are. Although we should be outside too, a lot of the times we aren't. So they're seeing the impact there, and just in terms of A&P, their lung structures are more vulnerable to air quality in general, not just soot. I would imagine, although I'm not the expert in soot, but yes, so children have not underdeveloped, but more vulnerable structures as a whole to sickness, to air quality. But definitely the being outside is a huge part of this. And so having communities where there are safe spaces with trees that is not near traffic, high traffic areas for our kids to play is paramount for their health growing up, and what their health is going to be as an adult. That's going to be very important.
Thank you, Lillian. Then Alex had asked if there's any relation between soil health and particulate matter.
So I may be able to provide some comments on that. I'm not. I may not be able to answer to the extent that Alex is looking for, but the point is, yes, there is a definite relationship between soot and soil health, because soot is primarily carbon and it's part of carbon getting back to the soil. In the short term, usually after wildfire and stuff, we do see the soil fertility increases in the short term, but that depends on the intensity of the wildfire and things. But part of this is caused by the release of nutrients because of the wildfire. There may also be some contribution coming from the particulates getting deposited on the soil. There are research going on in this area that how much does the particulate, it depends on what type of particulate we're talking about, how much does the particulate affect the soil health, soil fertility, and things like this. In general, if we're just talking about soot, people have looked into that, and I can't remember the conclusion is because I haven't worked on those areas as such, but I know there is a growing body of research looking into these. So I'll just stop at that, Alex. Sorry.
Thank you.
Jordan,
Yeah.
there was a question that was asked, is there anybody really trying to plant trees at this point in time? I know the anti-racism committee that I had with the Wisconsin Health Professionals for Climate Action is talking about wanting to plant trees and maybe to get grants to do that. I know that we've also talked about partnering with other organizations that may also have an interest in doing this to make sure that this happens. So I'm confident that with all of the different organizations that were represented on this panel, and even some of those that were not present tonight, there may be an interest in doing it for all of the reasons that we discussed, but a lot of work still needs to be done.
Yeah, I will add, so planting trees is from a spiritual aspect, religious aspect is very central, like to our faith as Muslims. So definitely and it's not just, I mean, it's across denominations and faith traditions. So it has a lot of significance in planting trees, religiously, spiritually, and of course, environmentally. So there is interfaith efforts in planting trees together. So it definitely like ground us in the soil, in the roots, in the unity of humanity when we plant trees. So that's we have an initiative that we work together in an interfaith setting. But I also want to mention that we're also part of Branch Out Milwaukee. That's an initiative to also look at tree equity. It's not just Milwaukee, there's also Chicago has a tree equity program, looking at those, mapping those areas that are lacking tree cover and zooming into those areas and understanding what the cause is and how we can address that. So there is a similar thing that's happening here in Milwaukee, and there in 2022, there was kicked off a Branch Out Milwaukee in Sherman Park. That was in April 2022 project. So you can look. This was a neighborhood-based, neighborhood-centered, neighborhood-led tree planting project. And so yeah, there is an effort to look into tree equity and some neighborhoods that really need tree cover. Yeah.
Yes, thank you, Huda. And yeah, there are a lot of community-led organizations. Nearby Nature, a great one. They work on renaturalization of different waterways in their neighborhoods. So thank you again, Huda, for sharing about that.
If I can add on, came across recently that MMSD has a wetland reforestation program. They're planting I may be wrong, 6 million trees in the next few years, and they have planned to plant 6 million trees in different Milwaukee neighborhoods and throughout the next few years. So they may have something going on, and maybe wise to reach out to them as well, so that we can contribute to that plan as well.
Thank you. We had another question for Langston. They asked if we know of potential people or organizations that could host an air monitor. Should we send them to your website?
Yeah, that's a perfect step. Just send them to mkefreshair.com. I'd love to have conversations with them about getting an air monitor set up. Also for folks, my goal is to share this data publicly with folks who request it. It's not my data. This is you know, folks who want to learn about or do the research, find some funding to support it. I'll gladly send you as much data as I can. I don't have the time to do all the research side of it all, right? And I don't love it. So I'd love to pass that along to the folks who do. The other thing that I would say as well is you know, there's been a lot of talks about trees, and I think that's one really important step. And I really think it's important when we think about equity and communities that have been historically redlined, thinking about policy solutions that have, you know, can double the impact or triple the impact of that, like clean energy cars, buses, trucks, thinking about our land use, our rules around what times of day these trucks can drive up and down Fond du Lac Boulevard, where we see many of our most concerning disparities as it relates to respiratory health issues. I think those things are you know, extremely important for us to, you know, also add into the conversation as well. So.
Thank you, Langston. Thank you for sharing that. And then not a question, but I saw that Pamela had shared that folks could partner with various agricultural and school groups. The Wisconsin DNR has an initiative for fourth graders regarding planting trees as well. And I can drop the link to that into the chat here. But then we do have a question from Cosmic asking if there is a direct correlation or relationship between soil health and climate change. And
One thing I can tell you about that is that with climate change and the confusion of the seasons, here we are in February, which is supposedly middle to end of our winter, and our temperatures were at 55 today. And I could hear the birds flying around, and I thought to myself, with these seasonal confusions, our plants and our animals are just as confused as to what's going on. They don't know how to travel back and forth as they would if the seasons were more normal and natural. And so those things all contribute together. I think the seasons for vectors of infection gets lengthened with global warming and a lesser winter as we've seen this year. And so that's going to increase asthma, allergy reactions. And when it gets back to what can we do about all of this, aside from the things that have already been discussed today, please don't forget your elders and your disabled people, because when it comes to rushing to get away from some major climate event, all of us who are able, we can respond on a timely basis, but our elders and our disabled people cannot. So we need policies in place to get them evacuated on a timely basis whenever we have these major storms as well. So don't forget them when you're thinking about all of these other things. Thank you.
Thank you, Dr. Settle Robinson. I just wanted to highlight that Huda has shared Branch Out Milwaukee's link in the chat, and Abby has shared Renee's article on preterm birth disparities, racism, air quality, and policy. The link to that as well. Two very great links to click on. And I believe that those are all of the questions that we have from attendees.
I don't know if the links were shared with everyone, or is it just the host?
Oh yes, thank you to hosts and panelists. Let me share it. Let me share it with everyone. Oops, wrong link, wrong link. Sorry about that. Let me get the Milwaukee Water Commons link out instead. All right, so now I put the link in the chat with the Branch Out Milwaukee.
Jordan, can you please allow Abby to speak too?
Oh yeah,
Oh, I can speak. It's okay. I've just been enjoying listening to everybody.
I
What
know you
amazing.
said that there was something you wanted to respond to, and Abby is a very integral part of our Wisconsin Health Professionals for Climate Action. I don't know what we would do without her. So if she has something to say, by all means, give her a moment.
I feel like everything that has been said so far has been really, really insightful. The only thing I would reflect on is if you have ever been sick yourself with a chronic illness or know of anybody in your life, whether it's a loved one, a neighbor, you know all too personally what you would have done to prevent that. And this action right here, taking policy action now, is exactly the kind of thing, if you could go back in time and prevent some of those illnesses, that we can do together. So that's why taking action is so important. And I always try to remember to think of, you know, my loved ones in that moment. When you feel that pain, when you're in the hospital, this is our moment before that happens to prevent that.
definitely, Abby. Thank you so much for sharing that. Then, since we don't have any other questions, I would just like to again thank everybody for joining and listening in and learning with us, and thank you to the panelists, for everyone for being so wonderful and so insightful, and taking the time to share your knowledge with us and motivate us to go out and submit comments and take action ourselves. And then thank you to Abby for being so wonderful and, you know, co-organizing this panel. And yeah, I believe that we haven't received any additional questions. If anyone has any final thoughts that they'd like to share, that would be wonderful.
Yeah, I would like to mention about the importance of air monitoring and the impact of air monitoring as a community-based effort. That was done with the Clean Power Coalition of Southeast Wisconsin. We did that collectively in the neighborhood, and it was very powerful for the community to be involved in and to see the data, and we used that data. It was really useful for us to really show We Energies that their power plant is polluting our communities. So that's really a case that shows how air monitoring can be beneficial to really making the case and to empower communities and catalyze community power to move against in a very systematic way and scientific way against We Energies. Yeah.
I want to put this on people's minds too. The COVID virus travels on particulate matter. And this is the reason why the minority community, which has the heaviest air pollution, has been the most heavily affected with the COVID pandemic. I know the average person in that community figured, well, it came from China, and I haven't even been to downtown Milwaukee, much less to China. So it's not going to affect me, and I don't need to take the shots or wear the masks or anything. But in fact, this is the community that needed the shots, the vaccinations, and needed to wear the mask more because COVID travels on particulate matter that's caused, that contributes to the air pollution.
I just want to add for anyone listening that you do not have to be an expert in this to get started. I certainly wasn't. As a nurse, I was an environmentalist. I, loved being out in nature, but I didn't know any of this information until about a year ago. And then I just kind of delved into it and kept going. And it's events like this that really kind of push you to learn more about it as you're preparing for it. So if you feel like, gosh, I don't even know where to get started, again, I say join an organization, learn from people that started where you did, but don't be scared to do that. There's a whole community, there's a lot of information out there, and you can just kind of get started just bits at a time here, especially with an organizational help. So you don't need to be an expert to speak to it, to talk to your family and friends about it, to talk to your neighbors about it. You can know just a little bit of knowledge is dangerous in a good way. And so putting that comment out there, or talk to your friends and family, your community members, your coworkers, just start and see what happens.
And tell your story. I was in DC talking with Senator Johnson in Baldwin's office, and we know one of them support this work and the other doesn't necessarily support this work, right? And has come out against climate change being a settled thing. But he couldn't argue with my story. He couldn't argue with the story of my daughter and my community. That part is the truth, whether he believes climate change is real or not. And so your story is valuable. So continue to share it.
I'd like to add to all that has been said is that here's a little plug for the exhibition that we're doing. It's basically sharing story. I mean, as a researcher, we often are very bad communicators. So this exhibition is kind of our attempt in collaboration with this artist to show us what's lurking behind this invisible layer. So please, if you have time, just come visit the exhibition. And as part of the exhibition, I mentioned this, we are also trying to collect air quality. We have several air quality monitors as well. We are trying to take these to several communities and walk with the people there while collecting the sample, listen to them. And this is, again, trying to give a sense of community and sense of agency, that what is there, and trying to make everybody understand the science and the art and the community of air, that we are all essentially living in a sea of air. We are all connected to each other by this air, no matter wherever we are.
Thank you. Yes, that is so true. And I do highly recommend everyone check out the exhibition that Dr. Somesh is talking about. I'm very excited I haven't seen it yet, and I'm very excited to be able to go and see for myself. And I think that is everything. We don't have any additional questions, and everyone has shared, some final thoughts. So again, I wanted to say thank you to all of our attendees, all of our panelists, and to everyone who helped make it happen. I'm very appreciative, and I'm so happy that I got to learn so much from everyone tonight. And yeah, I think that concludes the panel. All right. Thank you, everyone. Have a great night.